Endometriosis is a chronic and often painful medical condition that affects millions of individuals assigned female at birth, particularly those in their reproductive years. It occurs when tissue similar to the endometrium, the lining of the uterus, grows outside the uterine cavity. This abnormal growth can lead to inflammation, scar formation, and various symptoms that can significantly impair quality of life. What is endometriosis? Under normal circumstances, the endometrial lining thickens and sheds during menstruation. In endometriosis, however, endometrial-like tissue grows in locations outside the uterus, such as the ovaries, fallopian tubes, outer surface of the uterus, bladder, intestines, and pelvic cavity. Rarely, it can spread beyond the pelvic organs. This tissue continues to act like endometrial tissue. It thickens, breaks down, and bleeds during each menstrual cycle. But since it has no way to exit the body, it becomes trapped, leading to irritation, inflammation, and the development of scar tissue or adhesions. Causes of endometriosis. The exact cause of endometriosis remains unknown, but several theories exist. Retrograde menstruation. This occurs when menstrual blood flows backward into the pelvic cavity through the fallopian tubes instead of leaving the body. Genetics. A family history of endometriosis may increase the risk. Immune system disorders. A malfunctioning immune system may fail to detect and destroy endometrial-like tissue outside the uterus. Chylomictic metaplasia. This theory suggests that cells lining the pelvic organs transform into endometrial-like cells. Lymphatic or vascular spread. Endometrial cells might travel to other parts of the body through the lymphatic system or bloodstream. Symptoms. The symptoms of endometriosis can vary from mild to severe and may include pelvic pain, the most common symptom. It often worsens during menstruation but may occur at other times as well. Painful periods, dysmenorrhea, cramps that may start before menstruation and extend for several days. Pain during intercourse. Dyspareunia. Pain is often felt deep within the pelvis during or after sex. Pain with bowel movements or urination, especially during menstruation. Heavy menstrual bleeding, including bleeding between periods. Infertility. Endometriosis can affect fertility due to damage or blockage of the fallopian tubes or interference with egg release and implantation. Fatigue, nausea, and digestive issues, such as bloating, constipation, or diarrhea. It's worth noting that the severity of the symptoms does not necessarily correlate with the extent of the disease. Some women with severe endometriosis may experience mild symptoms, while others with a mild form may suffer intense pain. Diagnosis. Diagnosing endometriosis can be challenging, as its symptoms overlap with many other conditions. Diagnosis usually involves medical history and physical exam, including a pelvic exam to detect abnormalities. Imaging tests, ultrasound, MRI, or CT scans may help identify cysts or endometriomas, but they cannot definitively diagnose endometriosis. Laparoscopy, a minimally invasive surgical procedure in which a camera is inserted into the abdomen to directly view and sometimes biopsy the endometrial-like tissue. This is considered the gold standard for diagnosis. Stages of endometriosis. Endometriosis is classified into 4 stages. Stage I, minimal small lesions and few if any adhesions. Stage 2, mild more and deeper lesions, but still limited in spread. Stage 3, moderate many deep implants, cysts on the ovaries, and some adhesions. Stage 4, severe extensive disease with large cysts and dense adhesions. The stage does not always correlate with symptom severity or fertility outcomes. Treatment options. There is no cure for endometriosis, but several treatment options can help manage symptoms and improve quality of life. Medications. Pain relief, nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen. Hormonal therapy, birth control pills, GnRH agonists, progestins, and other hormone treatments to reduce or eliminate menstruation, slowing the growth of endometrial tissue. Surgical treatments. Laparoscopic excision, removal of endometrial lesions, cysts, and adhesions. Hysterectomy, in severe cases, removal of the uterus and sometimes ovaries, though this is usually a last resort. Fertility treatments, assisted reproductive technologies such as in vitro fertilization, IVF, may be necessary for those facing infertility. Living with endometriosis. Endometriosis is a lifelong condition for many. It can take a toll not just physically, but emotionally and socially as well. Chronic pain, fatigue, and fertility struggles can lead to anxiety, depression, and diminished quality of life. Support from healthcare providers, counselors, support groups, and loved ones can be crucial. Conclusion. Endometriosis is a complex, chronic condition that can profoundly affect the lives of those who suffer from it. While it remains under-researched and often misunderstood, growing awareness and advances in treatment are helping individuals manage symptoms, preserve fertility, and maintain a higher quality of life. Early diagnosis, personalized treatment, and compassionate care are key to living well with endometriosis.